A warm welcome to all of you who has joined us online, regardless of time differences in your perspective countries for the webinar today. My name is Tisal Fernando, and I'm delighted and very excited to be your host for today's session, which is organized by Nursing Now Challenge in collaboration with International Institute of Health Sciences. We will be discussing on the significance of leadership advancement in nursing and midwifery as an early career program, featuring Professor Lisa Baylis-Pratt, Program Director of Nursing Now Challenge, Dr. Kitsri Edrisinghe, CEO, Co-founder, Director Academic Strategy and International Affairs at IIHS, Ms. Glenda Whiting, a registered nurse, registered midwife and a health educator, and also the head of School of Nursing at International Institute of Health Sciences, Mr. Radun Ratnayaka, Senior Lecturer, Deputy Head of Academic Affairs at IIHS, Ms. Rita Agiki, Nursing Director at Abu Jaid Hospital, Lebanon, and Sephora Ireji, Challenges Committee Member and Board Member at the Royal Youth Mentorship Program, Kenya. We highly appreciate your valuable time and a very warm welcome to all of you. Now, without further ado, we will turn the time over to Professor Lisa Baylis-Pratt, Program Director of Nursing Now Challenge, to give the welcome speech and brief us on today's session.
Hello, everybody. It's my pleasure to say hello to you all. I'm the Programme Director for the Nursing Now Challenge, and I'm delighted that we're hosting this webinar in partnership with the International Institute of Health Sciences from Sri Lanka. We've got some fantastic speakers that I'm sure are going to inspire, educate and entertain you through the next hour and give you lots of great ideas about the leadership potential that Nursing Now Challenge in its community brings to you all. Thank you so much for joining us. Have a great session. I look forward to hearing all about it. Thank you.
Well, with that, I would like to welcome the next distinguished speaker, Dr. Kitsri Edrisinghe, CEO, Co-founder and Director Academic Strategy at International Institute of Health Sciences, to speak a few words on leadership inputs in undergraduate nursing and midwifery education. Over to you, sir.
A good day to everyone. Nice to be work with the Nursing Now Challenge. It's an excellent concept that we all know has done a lot of work. So let me share. I hope my screen can be seen. Can you see my screen?
Yes, sir, I can see your screen.
Okay, lovely. So let me look at the leadership in undergraduate and undergraduate nursing and midwifery training perspective, and how much efforts that we put into get these nurses in place. So if you really look at the largest roller coaster in the world and the more riskiest one is located in Japan. And because this is a race against the technology, race against the human endurance. So this of course, if you really look at it, we take lot of risks in a roller coaster ride. And also we have put certain things in place to make sure the health and safety is maintained in this part of the adventure. And similarly, if you really look at our human beings, they too have a roller coaster ride from the birth canal after swimming in the amniotic fluids for over 10 months, and then the whole life is itself a roller coaster ride. And this the most closest person in this roller coaster ride to make sure the health and safety of this particular person from to womb to grave is the nursing professional. So they really look at the midwifery level, and then they look at a neonatal level, pediatric, adult, finally geriatric. So therefore, it is essential that we all know that nurses, how much value that they add to human life and to maintain human life. And it's a perspective, the paradigm of nurses are totally different. they've shown how they look at things are totally different. So Barbara thinks it's not just making of babies, but making of mothers that midwives see as miracles of birth. See, what a wonderful phrase, quote. And they look at things totally different. Why nurses paradigm is so important and so different to the other professionals? It's basically when I searched for this, I found that they have infinite empathy. This is if you look at the empathy in terms of the professionals and the human race, I think nurses are on the forefront. So they have ability to connect with patients and to support them and to take that journey. And then they are superheroes. They have a superpower to absorb and safeguard these patients. Not only patient itself, the families, their siblings, spouses, and they go through the whole harangue of things, like from the diagnosis right up to the treatment, and even at the bed, So all that is done. So they think totally different look at humans, and has an extremely different paradigm of nurses. So once they move in, these are the navigators in our life, very close navigators. And then if you really look at navigators, so if you really look at the leaders and the navigators are capable of taking you anywhere. You can be a leader, but if the navigation is not there, you can be anywhere. Some say if you don't know where I'm going, I think Alice in Wonderland, if I may, right? When Alice jumped into the cave and saw this big rabbit, she asked which way to go. Then rabbit says, if you don't know where you're going, any road will take you there. So it's very important the leadership and navigation go hand in hand. But here what we have to really look at is that how much of leadership and navigation that we give our professionals. So let's look at, we've looked at the Sri Lankan context, and I've looked at several programs, undergraduate programs conducted in Sri Lanka in nursing. So if you look at the diploma, I looked at government sector and the private sector. If you look at the diploma in nursing in the state sector, we have 17 nursing schools. The leadership, there are no leadership program, not applicable, no curricula, it's not be seen properly. Though they manage themselves when they start working as two great leaders. In midwifery, same scenario. And then I'll come back to what the private sector is doing. Private sector, like for example, organizations like us, we do have curricular, co-curricular, extracurricular activities, which sharpens their leadership qualities. I'll get back to in a while. Then the bachelor's in nursing in the government sector, basically there are curricular activities. There are few curricular activities in leadership, but no extracurricular or co-curricular activity. Bachelor's in nursing, especially private sector or international delivered ones, you have seen there's leadership, and then of course there are curricular activities. Why this is important? Now, if you really look at if you're creating the 21st century nursing practice, there are 4 pillars that they have organized. They have identified: the care coordination, community health, leadership, quality, and the quality improvement. There are 4 pillars. So leadership has been identified as an essential pillar to improve the professionalism of all nurses. Now, what is the need of the hour? So the true sign of intelligence is not knowledge but imagination. So are we going to, now, if you really look at the nursing education, we look at the final job description of a nurse to do a procedure, a method. So we always look at slowly but surely, we do convergent education. We are thinking pattern become convergent. So at the end of the day, they were superb, excellent nurses with superb system. They have superb skills, but they would develop, absolutely, they will develop a tunnel vision. So as healthcare professionals, we look like stubborn to the patients and the client because we want to do that procedure to the maximum, the best way. So there's something in training that we might have to look at it. There are some medical schools now, they send their medical students for a reflection in museums, look at the arts and give simply to improve the right brain thinking or the conceptual thinking and the imagination, not only the left brain. So we continuously stimulate the left brain to be systematic and to be do things to a standard. So what is the 21st century professional that they need? When the COVID came, it hit us like a tsunami, and we couldn't think because we were thinking on the left brain. There was no system to cope up this. So initially there was some unfortunate incidences happened simply because we couldn't think. There were no leaders initially, but surely they took up the leadership because there were leaders who really inspired the others. Now we can have many COVIDs, we can have many tsunamis in future as a 21st century professionals. So what we have to do is to stimulate the 100 billion brain cells that we have, and also promote them to think, use common sense, the sixth sense or the common sense to do day-to-day activities. So what are we doing here? So I take IIHS as an example. So what we look at during the training, undergraduate training, what really look at academic and curricular activity which would stimulate their leadership qualities. One, so student-centric education. Obviously, within they would come out with their own characteristics of leadership amongst the small groups that they create. Then facilitating the divergent thinking rather than convergent thinking. We have some activities to stimulate the right brain as well as to think, having many answers to a question, not a one answer, but many answers to a question. And then evidence-based practice. So we are the leaders in undergraduate research. Now we will have our research conference, annual one in a couple of days, I think November 23rd. We'll be publishing about almost well over 230 to 40 research publications, all undergraduate publications, quite good. And then they would start thinking differently. And reflective practice is another one that we really have to inculcate in education, nursing education, where they would sort out a problem and come and explain it to the others, reflect themselves. So reflective practice also stimulates their leadership qualities. And of course, the critical thinking and activity-based learning, all that would give them to be a leader with maybe a small group and think differently. And then if you look at the non-academic activities, but there are academic activities, but co-curricular activities. So what we do is, whatever the non-academic activities, what we do, but we would give some curricular points for them. So they have the stimulation to do this. The leadership, teamwork, agility of kids, they have to be agile. When you have a leader, the leader has to take the forefront. And outbound training, thinking out of the box. Those are the things that we do at this particular level. And if you really look at the things that we do, we looked at extracurricular activities. The co-curricular activities, we have collaborative learning centers where there is a leader amongst this small group when they study. So during curricular activities, they would come up as leaders. And then they have many extracurricular activities. We have 5 student committees that would do different things. For example, scientific committees there, and then they would do all student activities related to studies. And then there is a student council who they organize all the fun activities or the celebrations. And there is a flora and fauna club, which would do environmental stuff. And then there is the Mad Society, Music, Arts and Dance. So they all do together. So there is within the program, without their knowledge, they become big leaders, very good leaders. And of course, the sports society would definitely give that extra added value for them. So these are the some of the pictures that they do here. And then in addition to that, they go outside and meet with the community and do many community projects. So it's now now time has come to us as academics and leaders of education to pass the ball to children. So there's a hesitance in South Asia to hold that ball back and to keep and push more towards teacher centricity. The time has come to push them towards more student centric education as well as academic, curricular, co-curricular, and improve extracurricular activities. And let's get responsive citizens who are very good humans who are humane. Thank you.
Thank you, sir. That was very informative. It is indeed an honor to invite the next speaker, Ms. Glenda Whiting, a registered nurse, registered midwife, a health educator, and also the head of School of Nursing at International Institute of Health Sciences, to enlighten us on the importance of career guidance for early nurses and midwives. Over to you, Miss.
Thank you very much, and thank you for the invitation to join you all. I'm actually joining you from Australia, even though I'm head of school at IIHS. So some of what I can share with you is about similar challenges, I guess, that are happening in Australia as well. So at the moment, the challenges that are facing the healthcare sector and the nursing workforce is nursing still seen as being a very rewarding career. And if you are currently practicing as a nurse or midwife, it is certainly a rewarding career. The access to really good quality healthcare is really more essential than ever, if nothing else we've learnt from those past few years. And as Dr. Kithsiri said, no group makes a bigger impact on patient care than nurses. We're the ones that are there 24 hours a day. So as nursing shortages continue, nursing leadership is really important and really vital to the success of the healthcare system. And nurses with high-level leadership knowledge and skills are really needed to make sure that they're a better outcome for patients, making sure that they build really strong teams and create really positive working environments. Could I have the next slide, please? So as we all have done at some stage, I'm assuming everyone has completed their trainings, but it may be that you are still in nursing training. The transition that we all make from being a student to a registered nurse, enrolled nurse or midwife is scary, exciting, filled with lots of emotions. So there's happiness that you've completed the course that you've done and you've graduated, but then there's that fear and anxiety about gaining employment, and then perhaps getting a graduate program, and then really being a nurse. That's what you've been practicing for and really kind of getting there. So there's all of those things going around. So when you're a really novice practitioner, you really question about what you've learnt, what the skills and abilities that you have. Have I made the right career choice? Is this what I want to do? And how will it be working with other nurses? And will they like me? And will I like them? All of those things that are sort of going through your mind as well as that path that you're taking on to following the career and the path that you think you decided you wanted to do. So if we provide graduates, enrolled nurses, registered nurses, midwives, whatever they are, the skills to start their professional journey, that really makes that transition into the workplace a lot easier. And some of the factors that we can do to help with that is things like making sure that the orientation programs have got realistic goals and competencies so that you know what it is you're supposed to be achieving and that's being measurable. You really need to have very approachable mentors and senior leaders. You need to make sure that there is constructive feedback given to you so you can improve on what it is you're doing. Making sure that there are staff development opportunities within the organisation for you, or at least to be able to provide you some sort of access to those as well. certainly communication, and certainly support when you're dealing with some of those difficult things, like, you know, when you don't have a good day, you have a deteriorating patient, or, you know, somebody does pass away, those kind of things that you may not be used to or have ever dealt with before. Next slide, please. So as far as that nursing leadership goes, as I said before, it's really vital that we make sure that, because it's rewarding and we've got all this impact on the patient care, we want to make sure that the leadership is there. And how do we go about being a leader? How do you learn that if, as we've mentioned in the previous presentation, if it's not part of the program that comes up? How do you get involved in that, and how does that really begin? So that can be one of the real difficult sort of challenges that we have when we first start out on our journey. Next slide, please. So what we really need to have is a dynamic, challenging profession that engages and inspires role models and leaders. So in the ever-changing healthcare environment that we're working in, it's very demanding, and it's really difficult sometimes to identify and develop nurse leaders. And it's really one of the challenges that is faced by the profession. So those of us that are in what we would like to say are our twilight years of our profession, is I constantly think about who is going to come and take over from me, who is going to fill that spot, who's going to lead and do that. So leadership is such a complex, multi-dimensional phenomenon. Research over all the time has shown that there's really not one universal definition or theory about leadership. You can read business leadership models, you can read healthcare leadership models. There's so many challenges involved in that. And what really is coming about is that true nursing leadership is very different to management leadership. So the path that some nurses take, where they become the director, the unit manager, is a different path to those who become a leader in a clinical sense or in that professional sense. So leadership means that we have to support colleagues, we have to do that purposefully, and we have to make sure that we can try and enlist willing and enthusiastic colleagues to continue on the path of providing good nursing care. A good leader also really inspires people to transform themselves, so that through the situations they develop their talents and they form a strong focus and a strong leadership, hopefully, kind of model as well. Next slide, please. So if we want to create effective and safe working environments, we have to have positive leaders, as I mentioned. Identifying those leaders can be quite difficult. Clinical nurse leaders are just as important as management leaders, and sometimes I feel we forget a bit about that. So the clinical nurse leaders are really important to the success of patient care and those patient care initiatives. And I'd like to think that good leaders produce and help to produce good care. If we can identify and support future leaders, the acknowledgement of shifting that makes us grow. The ultimate goal of our nursing profession is to provide excellence in patient-centered care. So if we can lead the way with that, then we can make sure that can be achieved. And also identify and nurture others into leadership roles by being a positive leader, possessing evidence-based qualities of leadership, and identified to nurture and lead further through that profession as well. Next slide, please. So this slide is just something from the Australian College of Nursing. And I really just wanted to mention that because the Australian College of Nursing has done a lot of work about leadership programs. And I think have identified that it was difficult sometimes for nurses, usually postgraduate nurses, to find a program that suits what they're trying to do. So there's a number of different levels within the leadership program, but I chose the initial emerging nurse leadership program, really to identify to you as something that is available, but also something if you're within that realm of being able to model something within your own organisation or country to do. So the Emerging Leader program really supports current and future nurse leaders from the undergraduate student level up until about the 6th year of practice post graduation, and really is designed to sort of kickstart that leadership. They give them access to mentoring, career coaching, professional development webinars and leadership workshops. It's a 9-month program, so the participants actually participate, build, network with high-profile leaders, and attend events and those sorts of things to try and access through that. So I think that finding a mentor and finding someone that you can access to speak with, or someone that you can model yourself on, is a really important part of that process as well. And then the last slide, please, is really something that you may have seen. I noticed this was on social media just recently, and it actually shows a picture of a US diver who dove into the pool and actually passed out and sank to the bottom of the pool. And her coach recognized that she didn't surface when she should, so she jumped out and saved her. And as you can see by the picture, she's actually holding her up and bringing her up to the surface. But the reason that it's something that I like to show is that it reminds us about that importance of coaching and mentoring. The coach had the ability to recognize that her student was underwater longer than she normally should be, and she had the desire to help. She had the willingness within her to save, and she acted while others on the sideline were watching. We also, I think, particularly within the healthcare field and with nurses, have many young people drowning right before us. And young doesn't mean age in this context, it means young in professional terms. So in different walks of life, we might watch as lots of people just walk away from the profession, as in the nurses with us. Some people have serious consequences from the pressures and those things and that drowning in front of us. Everybody needs a helping hand. If you're a young person that doesn't have a mentor, find one now. If you're a veteran, a seasoned veteran, and you don't have a mentee, exactly the same, find one now. And just to finish, there is no excuse for anybody to drown. Thank you.
Thank you, Ms. Whiting. That was an insightful presentation. Ladies and gentlemen, I would like to invite the next speaker, Mr. Nadun Ratnayaka, Senior Lecturer, Deputy Head of Academic Affairs at IIHS, to brief us on the specific leadership skills development through CPD programs. Over to you, Mr. Ratnayaka.
Thank you so much. Thank you so much, Tisal. So hope everyone can hear me clearly. Right. Okay. So let me share my screen. Right. So today I'll be speaking on generally, especially related to specific leadership skills that we can develop through CPDs, which means continuous professional development programs, where how we can improve our leadership skills. So moving on, these are the contents that I expected to cover. Especially, I would like to have you draw your attention what we mean by a leader and leadership skills, and especially what are the areas that we can improve through CPDs, and how we can move into continuous professional development, and also finally the contribution of IIHS towards this towards the availability of CPD programs. Right. So leader or leadership, this means the capacity of someone to make another professional inspired or influenced, and also to motivate, to improve, and to collaborate, to improve themselves, and also to achieve someone's goals. So in that case, generally, apart from sticking into your profession, you need to look outside the box. You need to understand human beings. You need to communicate with others. You need to know how they feel, empathetic manner. So in this aspect, CPD or continuous professional development plays a very important role in terms of adding value to the qualification that you already have. So this is a very good strategy that we can use to develop nurses into a leader. So CPD, it inculcates progressive and healthy learning environment, especially backed up with very good lessons and real-time scenarios. So this includes certain types of activities where you can address various types of learning styles, and also different types of scenarios which you can use your brain, use your mind in terms of critical thinking. Right, the first skill that we need to develop, especially to become a very good leader, is your communication skills. That is really important in terms of identifying yourself, in terms of sharing your thoughts, and also in terms of making a very good, healthy environment in sharing information. So, as a nurse, you need to share your thoughts and you need to understand what patient feels, and you need to communicate effectively with your patient. The successful outcome of nursing care especially depends on how well you communicate with your patients, and also how well you share the learned or the experienced patient aspect with other healthcare professionals. And what happens if this breaks down? What happens if you don't maintain a good communication skill? Ultimately, the bottom line is that will break down one aspect, your workflow and your effective outcome, and on the other aspect, the patient's well-being. So as a professional, we should develop these skills, especially the reason is our main objective is our patient. So to make them to make the availability of a better life or better life expectancy, especially communication is the vital communication is the most important skill that you need to develop, where it will help others also to learn from you. The next thing is human resource management skills. So as a leader, we should be able to identify what other medical professionals face, what they are going through, especially in healthcare setup. We know, especially in South Asian setup, there's a highly pressurized situations in clinical setup, highly burnout workload, and highly stressful circumstances that most of our nurses are faced. So if we can understand what they face, or if we can be empathetic on their working role, that means we also facing the same kind of scenario, and we also getting that experience. So that is where you can address the gap. That is where you can address the gap between your knowledge and also the required leadership or required management that that can be applied to that particular scenario to manage the condition in a better manner. So by fostering these relationships and creating nurturing work environments, which ultimately will give a better patient outcome, and also that will ultimately helps to better retention of nurses and other medical professionals in the healthcare field. So what happens recently with this COVID-19 pandemic, we experienced that lack of human resource management especially in most of the countries. Most of the nurses got exhausted with workload. Most of the nurses got distracted with their quality work. Why? Because they had burned out with high workload. So in a study which has done in 2016, they have found out that effective human resource management strategies are greatly needed to achieve better outcome from access to healthcare around the world. And the next very important skill that I think that needs to be developed as a leader is team building skills. The reason why I took this point as the third skill, because firstly, definitely you have to build up your communication. You have to be really good, clear communicator, and then only you can understand others. Then only you can think about human resource management. And once you can communicate and once you can manage your fellow colleagues, then ultimately that is the team that you want. So that will gives you a better care coordination, that will give you less mistakes, and that will give you better understanding among your healthcare team. And ultimately, you won't need to be labeled as you are the leader, because why? Your fellow colleagues treat you as a leader, because you are the one who communicate better amongst your team, and you are the one who handles your team better. And ultimately, they treat you as your leader, and they expect more advices and they expect more guidance from you. So that's why it's really important to create that surrounding, to create that foundation, and make that team building skills. Ultimately, it will be a really simple thing to a leader. So when treating patient as a team, not only nurses, with other medical professionals, and if you all can get together and take critical decision making and get those decisions correctly, and if you can see patient in different aspects, so that's what ultimately the patient also wants. He needs to be 100% sure about, the patient needs to be 100% sure about what his healthcare team doing to him. And he is expecting a better outcome, at least the normal lifestyle that he has spent, at least to go into that situation back again. So we need to see the patient in different aspects. So for that, you need a team. For that, to make a team, again, you need to have a very good human resource management skill. And to have that, you need to have very good communication skills, right? So if you develop that, as a result, definitely these skills will enhance patient outcomes, right? Then what is the role of CPDs? So this stands for continuous professional development, which is a term which is used to not sticking to a one particular qualification while you are studying. Add value to your qualification. Adding value, adding feathers to your qualification will be a really good aspect to be a nursing leader. And CPD is a comprehensive strategy to do that, because most of the CPDs available in the world are self-paced, and you can learn while you are working, you can learn while you are driving, you can learn while you are doing another task. So this gives you an additional advantage to become a leader through CPDs. So how CPD contributes to your career is that you can look ahead and spot opportunities. You can get that skill, you can get new knowledge. Apart from that, you can brushing up your existing knowledge. So generally what happens, nurses, when they work, they just expose into clinical setup, but they tend to forget different disciplines, different units, what they have learned, what are the management strategies that they use in different units. So if you are engaged in continuous education, yes, you get that exposure back again, and you refreshing your knowledge and you sharpening your skills. Or else you can continue whatever the way you are working currently, and you can get updated with the most recent advancements in your particular career or in your particular discipline. So as IIHS, I'm very much happy and privileged to introduce you all the fully online CPDs that we have introduced for the very first time in Sri Lanka. And also now we are capable of adding virtual reality in nursing education. So we are fully equipped with virtual reality education and also CPDs. So let me brief you on what are the available CPD programs at IIHS. So we have 10 CPDs. So there we have perioperative nursing care, critical care, trauma and emergency, oncology, and mental health. Then we are capable of delivering renal care, pediatric, wound care, nursing informatics, and nursing care for the older person. So in 10 different aspects, 10 different disciplines, you can develop these skills, you can develop these leadership skills by enrolling these programs. And I invite all of you to be a part of this and get yourself polished, skilled, and be a nursing leader where you can develop a better world. So these are my references, and thank you so much for your time. Thank you so much.
Thank you, Mr. Ratnayaka. Well, with that, we are moving on to the Q&A discussion as we are about to conclude the session. I would like to give the next opportunity for the members of the Nursing Now Challenge to direct your questions to the speakers. For that, I would like to invite Ms. Rita Akiki and Ms. Sephora Iraji to moderate the Q&A session.
Thank you so much for this great session. Really, it's very impressive to learn and to share all those experiences, especially learning online and this virtual learning that helps a lot nurses. I wonder if I can ask Dr. Kitsiri about our situation in Lebanon. Well, in fact, you know, we are facing multiple crises, especially the economic crisis, the burden at work. And what is really impressive with those young nurses, that they aim usually after they are graduates to have 1 to 2 years of experience, and then they want to search better opportunities outside Lebanon. What I would ask is, if you were at our place, what would you propose to our politicians, the persons in power, to do or to plan to retain those valuable future nurses?
Excellent question. And it's a question that is very common to all the, even South Asia as well. They would study for, they would work for about 2 years maximum, and then they would go for a green pastures. In a way, if I am a politician, I won't mind doing it, because I hope that they will bring dollars to my country as a politician. But as a nursing professional, you really, it's a really problem, because the first world, definitely we know the first world has a problem of nursing shortage, and they are absorbing the low-hanging fruits. That's the well-trained nurses from the other countries. Now, this will continuously. This will not happen, as to my prediction is, because they'll have to specially train nurses for those countries, and then that's one way of looking at it. So you specifically funded program from first world, they would fund, because otherwise the Lebanon funds or Sri Lankan funds, government funds, we train these nurses and they go. We are losing the investment. So the investment has to come from the first world. They would invest and then train nurses, and specifically for them. That number one. Number two, we should always allow them to go also to a better countries one day. A, they get the better exposure and come back and upgrade our system. B, that would encourage the others to take up nursing. Because nursing is a profession. I've been advocating nursing for the last 13 years. And when we started, only IIHS was the only private organization doing nurses training. Now we have 17. So we managed to create that hype. The nurses are more valuable in all parts of the world. So in a way, it's good to improve the professionalism and then the recognition rather than recognition. That's the word. So therefore, as a politician, I would rather look at, because we have enough unemployment in our countries. Rather than sending them unskilled labor, it's always better to convert them to skilled labor and send. So answer your question is very complex, but still I think there is pros and cons. The funding coming from the first world, supporting our training, then we can train, we can improve the capacity. Then we won't mind sending some. So that should be the model. That's my view.
Thank you so much.
Thank you so much, Dr. Katsiri. My question is surrounding this notion that has been going on, and I've had young nurses, especially in my country, say that, you know, nurses eat their young, where the older nurses, or rather the senior nurses, more experienced nurses, do not give opportunities to the young ones, or early career nurses who are coming up. You know, they do not give them opportunities to share their ideas or opportunities in leadership. So I'm just wondering then, how can we change this narrative, especially at the workplace, you know, as early career nurses start off in their careers? How do we change that narrative so much so that the young nurse is encouraged to use their voice and to share their ideas and to participate in leadership, while also encouraging the older nurses to be mentors and positive reinforcements towards the growth of the young nurses who are graduating rather. So yes.
I think, Glenda, you could talk about the first world. I'll talk about the third world.
Well, I think that it's a lovely question, thank you, and it is something that we all do grapple with. And I think I mentioned some of that in my presentation about the drowning people, and we've all lived through that feeling where, you know, and I think there's a few facets to it. One is about the culture of the leadership within which you're working. So if you are in a very positive unit, hospital, organization, whatever it might be, that promotes that communication and sharing of ideas and nothing is wrong to say, then you've got the capabilities of doing that. The other thing is that I mentioned at the end of that drowning episode, and I hope you all keep that in your minds, is that every person should have a mentor, and therefore every mentor has mentee. So if you have someone in your workplace who you can go to and say, I don't know, this might be silly, or I don't want to say it out loud to everybody, you know, you can share it with one person who is on your side, and they can either encourage you to develop the idea, or, you know, yes, go ahead and say it, that kind of thing as well. I think that helps that positive kind of role model part as well. But it's definitely about, and we've all can tell you, particularly us veterans, of working in places that didn't have a good culture. And even though I might be a very senior person, I don't want to speak up because you just get shot down. It doesn't matter. It's about all of those things coming together. So the junior people coming through, developing all of those skills. And as Nandan mentioned about learning communication skills as you're learning your craft and doing all of that as well, that you are then positive, you hopefully get to the positive workplace, and therefore you can improve that as well. So thank you. I don't know, Dr. Katsiri, if you have something to add.
Thank you, Glenn. It was a beautiful explanation. Zifara, I think the developing countries, Glenda hit the nail on the head saying about the culture. Either developed or developing countries, there's a culture of training and mentoring because our hierarchy in the nursing is very strong, and it's more of a autocratic hierarchical system we have, because you have the matrons and all that, you can't, and then there's a massive gap. And then the training itself is more of a military training. You know, you're about to have certain amount of discipline is very strict. Unfortunately, the youth have changed. The learners have changed. They are more modern. They are more technologically based. They are open-minded. They are more democratic rather than autocratic. that clash is there. I think the nursing leaders in the respective countries should take up this and reduce this gap and allow them to be in equally. Then the gap will reduce, and then automatically they will come closer. I can remember when I just walked into as a deputy director in a big hospital to manage that. My director did not give me a chair. Didn't give a chair. He wanted me to sit on the audience, the OPD, and just listen to him. So I did. Then he wanted to write, take notes like a clerk. So I did. Then he put me into acting. But amazing mentorship. But I learned to how to make policies, etc. It's a different way of doing it. But if I tolerated, I walked out like he's discriminating me and ill-treating me, I won't be here what I am now. So it's a different way of absorbing. I think the mentorship should be inculcated in our training. And I think we have to learn from the first world how they do things. And then that has to make culturally, we should change in the nursing field.
Thank you very much.
Thank you, Dr. Christy. You were really very resilient since the beginning. Well, I want to ask Mr. Nadoun, since you were through a learning journey with fresh graduate nurses, well, in my facility during COVID, we have implemented a cross-training program to mentor and to help the integration for the fresh graduate nurses. In practical issues, we were very happy. But when it comes to nurture the leadership of those nurses and to be more resilient, it has been more difficult. So I was wondering, what would you advise for me or for others that are facing same problems? If you can have some advice to us, thank you.
Yes, that is also a very good question where especially in Sri Lankan setup also we face this similar kind of difficulty where students won't get much of opportunities to make their decisions, so express themselves to give their clinical decisions and all. So as a solution for this, it's better we can expose them to the clinical setup at the very beginning of their course, and also parallelly, if we can run a course where leadership skills are inculcated, and if we can introduce them clinical scenarios, maybe using technology, VR simulations, scenarios, by introducing those scenarios, they see that scenario and they live in that scenario, and they practice to take decisions, and they try to criticize their others' decision, and they will have a very fruitful discussion amongst themselves, and ultimately that develops their communication skills as well as team building skills. So what my opinion is, from the very beginning, we have to gradually improve their clinical exposure and let them practice to take decisions, not to put that decision in the real world, but to practice how to make decisions correctly and how to see a scenario in different aspects. So by introducing these sort of courses or these sort of practices from the very beginning, I think that will improve the decision-making abilities and also leadership skills.
Thank you, very helpful.
Yeah, I really love, the aspect of actually practicing, these different skills. A question to you, Miss Glenda. Just wondering, when I was a student, my curriculum, and this has been the case for most nurses, and I think it has been mentioned in the presentations before. There's a lot of incidents on, gaining practical clinical skills, so that now when you're done with school, you get into a hospital or get attached somewhere and start practicing those clinical skills. But as I've grown in my career as a young nurse, I have realized that there are a spectrum of spaces that nurses can actually make impact, in looking towards improving health, in the spaces of nursing research, nursing education, nursing entrepreneurship, where we have nurses, coming up with products or equipments that help in the provision of care, and other aspects that, we would love to have, like nurses' expertise, coming in and helping us out, even in global health, in public health, and all these spaces. But then now, because the curriculum heavily now focuses on clinical aspects, you find that a lot of nurses are shying away from exploring their other opportunities for greater impact. And that as well is also due to like the few mentors who have already chosen different paths, either in entrepreneurship or research or education. So I'm just wondering, from your perspective, what is the solution to this? What would you encourage governments or lecturers or those who write the curriculums to do, so that now we can be exposed as early as at the student age to all these aspects, or all these spaces that we can have an impact, even for improving healthcare and improving our communities? Thank you.
Thank you for that question. If only I had the answer to the fixing of the world. That's how it feels, wasn't it? Like, how could you just fix everything? I think that we would all agree that whichever path of training curriculum or however it is that you train, there is a very heavy emphasis on the practical parts of that components. And I always used to find too that the students much more enjoy doing things than listening to things. So if you taught the softer subjects like communication, like dealing with diversity, evidence-based practice, everyone would sit there going, they'd much rather be in the skills lab doing all the fancy things and taking blood and doing all that. But when you actually get into the workforce, you actually realize that you need all those skills as well as the practical skills as well. So it's a bit of a development sort of issue. We can't just extend the program forever. No one would ever come do it. So again, I think it's a bit about trying to weave within the curriculum, a bit like Dr. Kisiri said with his at IIHS, that you have extracurricular things where you encourage research, you encourage leadership, you encourage even from your staff to be participating in those things, because then they're becoming leaders in those things as well, that you're hoping the students will follow. Again, when you get into your early career, you get over that first transition of I'm suddenly a real nurse and I have to do things to people, that you find that mentor and you start to chat to them about, where do I go? What can I do? Do I want to specialize in a particular area, whatever it might be? And if you have good mentors, as I said, they're people you aspire to be like. And I think we've recently introduced a mentoring program at IIHS. And one of the things that we do at the beginning is say to people, think about someone that you knew that you just went, I just want to be like them. And then try and work out why you wanted to be like them. It might have been a sport coach, or it might have been a teacher at school, or it might have just been because they always looked like they were so calm and collected. Then try and work out how they go about it and do that kind of thing. So it's a really hard question to do. I think we have to weave it into everything. We have to make sure that we can try and lead people and get them to understand that some of those softer things when you're learning are just as important as the practical things. And then hope that when you get out there, you find someone that can inspire you and that you can have as a mentor and follow them. I don't know if anyone wants to add anything else.
Glenda, we have excellent description, Glenda. That was really good. One of the things that I find difficult to control during undergraduate training is the curricular activities we can do, the academic activities, and extracurricular and co-curricular we can control and then make sure the leadership qualities would inculcated into them. But the clinical setting is the difficult one during student days because they would, the gap is so large, huge, and we have to get them closer to the mentors or the supervisors. So that's one of the challenges that we face at the moment.
Yeah. Well, thank you so much for your responses.
Thank you. I think we all learned a lot from that Q&A session. Now I would like to welcome back Professor Lisa Baylis-Pratt, the Program Director of Nursing Now Challenge, to give the concluding remarks.
Thank you so much for joining us on this really interesting webinar. I wish you all the very best for the rest of your day and very much look forward to connecting again with you soon.
Ladies and gentlemen, that concludes the proceedings for this webinar. Thank you everyone for joining with us. We appreciate your participation and we hope you gained knowledge on the significance of leadership advancement in nursing and midwifery as an early career program. Also, I would like to say it is the pleasure of IIHS to partner with Nursing Now Challenge and give an opportunity to gain a global exposure to our nurses. Thank you once again and have a nice day.